What vitamin deficiency causes fatigue? If you're sick and tired of feeling tired all the time, then you may have found yourself asking that question. If that's you, then you're in the right place. Not only am I going to answer that question, but I'm going to share with you a behind the closed doors method for trading in your fatigue for limitless energy. Let's get going. Hi, I'm Dr. Kelly Shockley, Doctor of Cause Chiropractic, board certified in sports medicine and specialized in clinical nutrition. In this video, we're going to go over the little known vitamin deficiency that will have you feeling wiped no matter how much sleep you get at night. Then we'll cover the most common mistake you're unknowingly making when it comes to dealing with fatigue. The short-term gain is not worth the long-term impact. And finally, I'll be sharing with you the behind closed doors method for trading in your fatigue for limitless energy. Let's get started. Now, what is the little known vitamin deficiency that will have you feeling wiped no matter how much sleep you get at night? I am talking about vitamin D. Now, vitamin D is also known as your sunshine vitamin, so maybe that gives a little bit of, shedding some light on the fact that it could contribute to energy levels. But most people recognize vitamin D for bone and teeth health. And now, ever since this past year and a half, we are starting to have more appreciation that vitamin D actually has a lot of influence over our immune system. But what we don't really appreciate is there's so much more that vitamin D actually influences. Not only is it great for bone and teeth and your immune system's health, it's also incredibly important for brain health. So being able to focus and concentrate, having laser sharp memory, mood regulation, so not fluctuating between feeling happy and depressed, anxiety, all of that. Anything related to brain health has huge impact when it comes to vitamin D levels. But the one that most people really don't know anything of is the fact that if you do not have a sufficient level of vitamin D in your system, you are not going to have a high level of energy. Now, what is sufficient? Clinical reference range, what the whole medical world uses, would like to see your vitamin D level at least a 30. I'm not going to give you the units because that's not necessary. Everybody uses the same. They want to see you at 30, okay? Based off of what I know on the clinical nutrition side of things and this more functional, holistic, whatever you want to call it, side of medicine these days, we see that people do better if their vitamin D level is at least a 55. And as far as immune system function and how it's correlated with this nasty infection stuff we don't want to talk about that's gone on over the last year to year and a half, people that were anywhere from 60 to 80 weren't affected at all. So 30, while considered normal by traditional medicine, still may not be quite sufficient enough. So you want to bolster your vitamin D level if you want to have high levels of energy. Now, one thing about vitamin D is it is a fat-soluble vitamin. So that means you do have the potential of getting too much in your system because it's not like vitamin C where your body will just eliminate it through your urine if it can't absorb everything you're putting in. That's a water-soluble vitamin. Vitamin D is a fat-soluble vitamin, so it will increase its levels. There is something to be said for knowing what your vitamin D level is before you just decide to start supplementing with vitamin D supplement, which, quite honestly, is probably the most effective way for getting your vitamin D level up. It's really hard to go out into the sun, expose enough skin on a daily basis when the sun is at its prime point to get enough vitamin D from the sun, okay? So we do want to supplement, but we want to know what our vitamin D level is first. And it is important, guys, because believe it or not, it takes a lot to get to this point. But when you start getting too much vitamin D in your system, one of the detriments that happens is it pulls calcium from your bone and puts it back into your blood. Now, what is the problem with this, you wonder? You get too much calcium in the blood, you can trigger kidney failure and a heart attack. So, not to do fear-based anything, it's just supplementing, we're also good at self-medicating. And I've done the same thing when it comes to supplements, but it's better to know before you just start adding things into the equation. Because unfortunately, even though they're supplements, there is risk associated with them. You need to know what you're doing. Okay, so get your vitamin D level tested. If you don't know how to do that, comment down below. I can help you figure that out from wherever you're at. But know what your vitamin D level is. And if it's not around 50, increase. Most commonly, the best dose for adults is 5,000 IUs, which is international units, 5,000 IUs of D3. And I get that combined with K2, which K2 helps keep calcium in the bone where it belongs. Okay. Other benefits of K2, but that's kind of the important one as it relates to D3. Taking 5,000 IUs per day seems to be a pretty good maintenance dose, but we're not all the same, so that doesn't necessarily apply to everybody. That is the littlest known vitamin deficiency as it relates to fatigue. Of course, there's other vitamin deficiencies that can contribute to fatigue. There's iron as it relates to iron deficiency anemia. There's B12 as it relates to pernicious anemia, magnesium, vitamin C, copper, coenzyme Q10, zinc, vitamin E, potassium. So there's a lot of different nutrients that can contribute to you not feeling energized. It's good to know where all of those are at, but vitamin D is kind of the star of the show as far as I am concerned in today's topic. I'm super curious. Did you know that vitamin D was actually linked with extreme levels of fatigue or a lack of energy? Put your answer or your response down in the comments below. I read every single one of them. I really appreciate you giving me the details and the feedback. So thank you for doing that. Now we want to talk about just two common mistakes you're unknowingly making when it comes to trying to get more energy or, get rid of the fatigue. First one we need to talk about is caffeine. Okay. Now, I know not everybody reaches for a cup of joe first thing in the morning, but there's a lot of people who reach for a cup of joe first thing in the morning. And it's well known that don't talk to them until they've had their first cup of coffee because they just don't function without it. Caffeine, we know, is going to stimulate the body. It's a stimulant. It's supposed to energize you. It's supposed to pick you up and help you get going, right? But utilizing on a regular basis does have detrimental effects. One of the challenges with caffeine is it's not long lasting, right? And it seems to be almost like you can develop a bit of a tolerance to it, just like you can with alcohol. So it's like one cup of coffee used to get you going, you felt fine, and you could do your whole day. Well, now you have to have 2 cups of coffee in order to get the same result. And then the next thing you know, you're drinking a whole pot of coffee to try to get the same result. And then the other challenge with this is caffeine is generally in and out of your system within about 3 hours. And, we get this steep incline and then we crash and we feel depleted. And oftentimes we feel worse once this caffeine high has worn off in our system and we're turning to reach for another cup of caffeine. Okay. Ultimately, consuming too much caffeine is very detrimental for your health and well-being. It will dehydrate you. It does cause other issues. So not relying on caffeine to get you going in the long run is going to be helpful. I know initially not great. So there is a thing as caffeine withdrawal when you start to decrease the caffeine. Don't just cut it cold turkey. You'll probably feel pretty gross. Headache is the most common type of symptom people get when they cut caffeine out. So slowly start decreasing the amount of caffeine. A better way to boost your energy first thing in the morning would be to exercise. Get that blood pumping. Even if it's like a 15 minutes of just brisk walk around the neighborhood or jump on the treadmill or, jump on a trampoline. It doesn't matter. Just get up and get moving and you'll find out that actually stimulates you and energizes you better than caffeine. And if you can do this when the sun is up, the sun actually energizes you better than caffeine does, even just 10 minutes out in the sunshine. So if you're starting to have that, mid-afternoon crash, maybe ward that off by going out at lunchtime, getting some fresh air and some sunshine to charge you and keep you going throughout the rest of your afternoon and evening. The other most common mistake we're making is alcohol. Alcohol is a depressant, okay? It does not actually help you be energized whatsoever. But I know it's something that people just commonly do, whether it's a social thing or it's turned into a routine when you get back, from working all day long into the day, you want to kick back and relax. But it actually does so many different harmful things into the body, and robbing you of your energy ends up being one of the results. Part of what happens of how this can also directly affect energy levels is how your body processes alcohol. So if you are somebody who likes to have alcohol in the evenings before you go to bed because it helps wind you down and you feel like it helps you fall asleep, what you might find out on those days that you consume alcohol is maybe you're not actually sleeping as soundly as you could. Maybe you wake up part in the night or you wake up in the morning feeling like you didn't sleep at all. And you wonder what in the world that was about. How your body processes alcohol, somewhere along the way, there's a component where it's almost like a stimulant, which is part why, yeah, you'll fall asleep, but then you can wake up, is because of this, where we're at with processing the alcohol out of our system. It really does lead to poor sleep. So obviously, that's not very productive if we're trying to energize ourselves. My ultimate, I don't drink, but maybe once a year, and it's not, I don't like any of it in the first place. So I obviously would say, just don't do it. There's really no great benefits that come from it, or not significant enough benefit from consuming any form of alcohol, even red wines, that would counter all these other potential issues that can come as a result of drinking alcohol. If that's not in your wheelhouse, it's fine, but minimize it. Don't do it every single day. Maybe do it once a week, but only maybe have a glass or two of wine if that's what you're choosing, or one alcoholic beverage a couple of times a week. I wouldn't do more than that. There's too many negative health effects that it's having that nobody's really talking about. Okay? And it is not going to help you feel energized. Now, before I get into the behind closed doors method that helps you trade in your fatigue for limitless levels of energy, I just want to take a moment and remind you to click the subscribe button down below, turn the notifications on, and while you're down there, hit the like button if you've been enjoying this video. I appreciate that greatly, and subscribing, make sure you never miss out on a future episode. I am regularly producing videos to help you take back control of your health and achieve what I like to call total body mastery. So just click the subscribe button, hit the like button, turn the notifications on, and you will be set. Awesome. Okay. What is this behind closed doors method that takes your fatigue and trades it for limitless energy? It's something I like to call figuring out the cause of your problem. Okay. In my office, the fancier way I say this is, if you're not testing, you're guessing. There are far more causes of fatigue than just nutrient imbalances and deficiencies. There's all kinds of different health issues that fatigue is one of the main symptoms that might present first before anything else shows up. If you really want to actually be able to have limitless levels of energy, you have to have optimal levels of health. Now, why do I say this? Your body, if it's not functioning the way that it should be, or if its nutrient demands are not being satisfied, there's a few things about this you need to know. Your body will rob Peter to pay Paul. So if nutrient demands are not being satisfied, and you're basically, what that means is you're not getting enough good foods in with enough nutrient variety to support optimal health. Or maybe you are, but your body's not functioning the way that it should because of one reason or another, one health condition or another. It's not able to absorb all the nutrients that it needs in order to support optimal function. Then it's going to rob Peter to pay Paul. Now, what I mean by this is it will sacrifice different tissues in the body and break them down, take their nutrient makeup, and give it to other tissues in the body that are more important. And just as it does this in order to function and survive, there are certain aspects of how we feel and how we function that are not 100% important for our body to allow us to have or to do or to be or to feel in order to survive. So bear with me, okay? I'm going to give you a few examples and then explain how this relates to energy levels. So if your body had to pick between your hair, skin, and nails or your liver for being able to survive, which of those groups would your body choose to sacrifice? If it had to pick one, it needs to take the nutrients and give it to other places that are more critical for survival. If you said liver, you're spot on. Well, if you said liver that your body would keep, that's correct. If you said your hair, skin, and nails are what your body's going to sacrifice, 100%. So ultimately what that means is your hair, your skin, your nails, while it's really nice to have them in good working order, and we appreciate when they look nice, they are not essential tissues in the body. They are non-essential. Your body can actually live without them in good working order. Okay? But your body can't live without the liver in good working order. Let's get into the next set of options. What about your muscles, your bones, your connective tissue, cartilage, or let's say your liver? What do you think your body would sacrifice first? If you said bones, muscles, cartilage, connective tissue, joints, all those guys, your musculoskeletal system, you are correct. My patients, when I ask them this, they look at me like, I don't know, like, you can't really function really well. No, that doesn't mean it's going to be comfortable for you, but your liver is more important. Okay, and this, I promise you, is not just about the liver, but just to clue you in a little bit, your liver has 500 different jobs. It does 24/7. Super duper important. So your body will break down bones, muscles, connective tissue, joints, cartilage, in order to free up nutrients to give to your liver or some of these other key players I'm not mentioning right now. Okay. So ultimately what that tells us is, generally speaking, anytime somebody has an issue with their bones, their muscles, their cartilage, their connective tissue, their joints, that's not where the cause of the problem is. That's not the primary issue. It's a result of something bigger happening. Make sense? Think of it this way, like osteoporosis, where we're decreasing the bone density. It is a condition. That means it's a result of something else. It is not where the cause of the problem is. Okay? So the last question I have for you is, what do you think your body would sacrifice first in order to live? Hormones or your liver? Just so you know, this is one that gets everybody. Okay? If you said hormones, then I didn't stump you. Now, I know we need hormones in balance in order to feel awesome. We feel crummy when we're out of whack. And we feel amazing when somebody gives us hormones back. But they are still one of the tissues the body will break down, rob Peter to pay Paul, the liver, and also all the rest of the organs. Okay? In your body, the tissues that are most important for you to survive, that we need to keep in good working order, are all of your organs. So if nutrient demands are not being met, your hormones, your hair, skin, and nails, your muscles, your bones, your connective tissue, cartilage, joints are all going to be potentially sacrificed in order to keep your heart, your kidneys, your lungs, your pancreas, spleen, all your organs operating. So if that's happening beneath the surface, let me ask you a different question as it relates to energy. Is having a really high level of energy important for survival? No. I mean, yeah, it's nice to have high levels of energy, but you can survive without high levels of energy, right? I mean, we're doing it already. You're here listening to me right now because you've been dealing with fatigue. You're still living. You're just not living vivaciously. Here's another one. Do you think your body would shut down your ability to reproduce, to actually, get pregnant, have a child, if not everything's working correctly? No, because for your specific survival purposes, it is not important for you to be able to reproduce. I mean, for us as a whole, as a society, it's important, but you specifically as the individual is not important. Okay? So maybe that's part of why we see so many issues with infertility and people having challenges getting pregnant and keeping a pregnancy to term. Maybe there's something else going on in the body where the body's robbing Peter to pay Paul. Being able to grow a human is not 100% essential for our living purposes. That's starting to make sense. I mean, this is not information anybody talks to you about. So the point is, fatigue, feeling fatigued, not having enough energy, generally is because there's something else going on in your system that's affecting it. It's not generally just because you don't have enough vitamin D or B vitamins or magnesium or copper or all the other nutrients that I just listed. And even still, if you went and you did nutrient testing and you found out you're B deficient, you're D deficient, you don't have enough copper, you don't have enough zinc, and you added those nutrients in, sure, you would probably feel better. But my bigger question is, why were you deficient in the first place? Is it purely because they're not in your diet? Or is it more because maybe your digestive system isn't working the way that it should, so you're not absorbing what you're putting in? Or is there some other underlying health issue that's taking those nutrients because it needs it more because it's not working properly? Is there a Peter robbing Paul scenario happening within the system? If you truly want to trade in your fatigue for limitless levels of energy, you have to figure out the underlying cause of why you are fatigued in the first place. If you don't find out the cause and all you do is treat the symptom, we're just managing fatigue here, right? And we're looking for ways to improve energy. You will never have limitless levels of energy. You will always figure out that you have to continue to try different things because you're not going to get the energy that you're after. You have to figure out the cause of why you're feeling fatigued in the first place. Now, if you're sitting there wondering, Kelly, how on earth am I supposed to do that? Like, I've seen my medical doctor, they say everything's fine. But obviously it's not because you're still sitting there fatigued. That's okay. I have information for you. I have answers. I am here to support you and guide you. This is what I do all of the time with people near and far. It doesn't matter where you're at. What I want you to do is I want you to click down on the description that's below this video. Click on it so it expands. In there, I want you to click the link that says From Sluggish to Unstoppable. This is my free gift to you for you being here and staying till the end. This is my ebook that explains exactly how you're going to trade in your fatigue for limitless energy. And it lays out the framework I use successfully with my patients and have for years all over the place and give them more energy again. So click the description, let it expand, find the link for my ebook From Sluggish to Unstoppable. And that will give you the answers of how you're going to figure this out. Okay. I am so grateful that you were here. I hope that this, shed some light, gave you a different perspective, gave you some hope in knowing that you don't have to feel this way for the rest of your life. And I can't wait to see you on a future episode. God bless.